Hi, my name is Dr. Ted Lain. I am a board certified dermatologist in Austin, Texas. I'm also a clinical trialist, and I was an investigator on the phase 3 program for Leqselvi, also known as deuruxolitinib. In the trials, we had 8 milligram and 12 milligram dose groups, but moving forward for commercialization, only the 8 milligram BID dose is approved by the FDA. There was a clinical trial called the THRIVE-AA1 trial, which was part of the phase 3 program. That's what I'll be referring to today. Now, the primary efficacy endpoint, as with all of these alopecia areata trials, is achievement of SALT 20 at week 24. That means that the patient has achieved 20% or less of hair loss on the scalp using the Severity of Alopecia Tool, or SALT. Just remember that salt is bad. So the higher the salt, the more hair loss, the lower the salt, the better. And so for the primary endpoint, it's SALT 20. In order for patients to meet criteria, they had to have at least a SALT 50, or about 50% of their hair had to have been lost, which is pretty darn severe alopecia areata, and certainly not the average alopecia areata case that comes into our practices. In addition to meeting that criteria, in terms of the amount of hair loss, these patients had complete or near complete hair loss, and about over half of patients were very severe. So 95 or higher on the SALT score were over half of the patients. The rest were between 50 and 95. The median duration of the current alopecia areata episode in the trials was about 2.9 years. And in terms of nail involvement, about a third of patients had nail involvement. And regarding eyebrow and eyelash involvement, about a little bit more than 2/3 of patients had loss of brow and lash as well. So these patients were, as I mentioned, quite severe. Now, in regards to the primary efficacy endpoint measured at week 24, so remember, these were patients who had lost at least 50% of their hair. The majority of the patients in the trial had actually lost more than 95% of their hair. So when we think about achieving a score of SALT 20, it's actually quite difficult, right? It is a huge amount of hair regrowth when you've lost 95 to 100% of your hair. Getting down to only 20% is a very large amount of hair regrowth to achieve by week 24. But about 30% of patients did achieve that in the clinical trial by week 24, 29.6% to be exact, in the 8 milligram BID dosing schedule. Now, what was really interesting about this trial was that we saw statistical significance versus placebo as early as week 8. And if you look at the graph of improvement from week 8 through week 24, it is a graph with a steady slope that continues up. There's no plateauing through week 24. And so looking at that slope, one might expect to see continued improvement over time, and that data would be in the open label extension. But it's also interesting for this trial with this JAK inhibitor in particular that we see such a progressive improvement. Usually with JAK inhibitors, it's kind of all over the map, right? You have some fast responders, some slow responders. Usually the patients with the higher SALT scores respond slower, but this we see a very nice steady improvement. And so you can tell patients that it looks like there's a linear response between dose and time, which is really nice for counseling patients. Now, in regards to safety, this is a JAK inhibitor with the box warning, although in the 8 milligram BID group, at least through the short term, which of course is only 6 months or 24 weeks, we really didn't see any kind of safety signals that were concerning. Certainly nothing that was hugely dose related. When we look at CK increase in about 6% of patients, 2% had an increased weight, increased cholesterol in about 1% of patients. Platelet count increased in 2%. And then there were some other lab work abnormalities, but nothing to be totally concerned about. 0.9% had an increase in HDL. Otherwise, as we can see with most other JAK inhibitors, we see an acne incidence of about 8.9%. And we see very low incidence of gastrointestinal disorders at less than 1.4% with diarrhea, 2% with nausea, and then really all other AEs are very low, less than 1%. So in regards, as I mentioned, to the box warning, any age related to that. We have zero thromboses, zero malignancies, zero emboli, myocardial infarction, or stroke were both at zero. The only thing we did see was one case of herpes zoster, and about a quarter of patients had experienced any kind of infection. So really, in regards to JAK inhibitor family, this fits right in with what we would expect, especially in this young and otherwise healthy population. We see that this JAK inhibitor was tolerated very well with really nice, reliable linear results for SALT improvement. Thank you.